for making time to join this webinar. We are so happy to have all of you. And based on why you're joining us, good morning, good afternoon, and good evening. So my name is Lucy Rehonge, currently serving as the head of program here at Flone Initiative. I'll be your moderator for this webinar. And I just want to point out that we have accessibility functions for this webinar. If you're a person with hearing impairment, our sign language interpreters for the day are Stephen Onyango and Philista Adundo. Please pin them, and they're also pinned at the top of the screen. You're advised to share your feedback in the chat, the comments, and any information that you'd like us to know. And of course, the questions that you may have to the panelists and of course the speakers, please feel free to share them in the chat. This webinar is structured in form of presentation, and also we will have a panel discussion. But before that, we'll have opening remarks from one of the supporting partners. From there, we'll have a 20 minutes presentation from Ivan Sumba, who is our program officer. And then we'll dive into a panel discussion that will be guided by myself and speakers from Machakos County government. Before I welcome our first speaker, I just want to give a brief background on why we are here today. And today we will be disseminating the public transport policy, the policy brief on addressing sexual gender-based violence in Makueni public transport system. And just to give a brief background on the current status of sexual gender-based violence within the public transport system in Kenya, you realize we have about 88% and 79% of women commuters and women operators having been survivors of sexual gender-based violence. And based on data again, most of the perpetrators of this act are male operators, and most of these incidences actually happen within the public transport system, inside the matatus or the 14-seaters minibuses, or at the bus parks. And they happen throughout the day, but you realize during the evening, these incidents are mostly common. And again, based on the research that we've done previously, about 60% of women do not feel safe while using or working within the public transport sector. And this again has a ripple effect to their access and control over socioeconomic and political opportunities. And maybe Evans, you can move to the next slide. At Flone, we mainly focus on 5 key areas, and we look at the inclusive and functional public mobility system. We also look at health and environmental sustainability in mobility, where issues of safety, inclusivity, climate change are enshrined. And we also look at issues of research and data generation, where we bridge the data gap on issues of disability and inclusion. And also in terms of policy engagement, we also work closely with national and county government within Kenya to ensure that the public transport system is inclusive, accessible, and reliable for all commuters. And lastly, we also work with partners to ensure that we sustain the activities that we do on day-to-day basis. Next slide. So I just want to highlight some of the work that we've done in strengthening accountability in regard to response, prevention, and protection of survivors from sexual gender-based violence in public transport. And one of the things as Flone we've managed to do is providing technical support to government at the county and national level. And in Machakos County, for example, we were able to offer technical support in developing their first sexual harassment and gender-based violence policy, which is currently being implemented. And in Nakuru County, we supported in developing a public transport code of conduct that again talks about issues of sexual gender-based violence, inclusivity, climate change. And lastly, we are currently working with Makueni County in again supporting in developing their public transport policy. And I just want to highlight that in this policy, there are also components that address issues to do with sexual and gender-based violence in public transport. In terms of awareness and advocacy, if back, if you check back in history, we are the co-organizers of My Dress, My Choice campaign back in 2024. And as a result of this campaign, most of you can bear me witness. We've seen the autonomy the women have when they are navigating the public transport system without being questioned on how and what they need to dress on. And then we've also been training public transport operators, and so far we've reached over 100 public transport circles, just creating awareness on how they can effectively respond, prevent, and actually address issues of sexual gender-based violence within the transport sector. And we've also been organized multi-stakeholder dialogues, bringing together private sector, government, and of course the legal system, and including the police, to just chart the way forward in terms of addressing issues of harassment within the sector. In terms of research and data, and you can as well check on our website, we've done a couple of research publications on highlighting issues of violence against women in the transport sector. And of course, this year, we have another status report that we are publishing, trying to look at the status of violence against women within Nairobi transport system. Again, feel welcomed. We are so happy to have you. And with that, I would like to welcome our first speaker, who is Paul Curtis. So Paul Curtis is currently serving Paul Curtis is currently serving as the Director of Transport and Mobility Research and Development for SLR Consulting. He has more than 18 years of experience in designing and delivering sustainable mobility and planning solutions for public, private, and private sectors. He manages the company's program of research and data projects, working with cross-sector partners from the USA, Europe, and Middle East and Africa. He leads research in the ways new mobility services, transit technologies, and policies can affect change in travel behavior, and also looking at issues of how to tackle sexual gender-based violence in sub-Saharan Africa. He is the coordinator of the Empower project funded by the UK government, which has delivered the She Can tool, which gives stakeholders the means to improve access to transportation for women and girls through improvements in policy design and capacity building. And I want to mention that you will find the link to the She Can tool in the chat. And with that, Paul, you're welcome.
Brilliant. Thanks, Lucy. Good to see you. And hello, everyone. Good morning from me. I'm based in London. Good afternoon, I think, for most of you. Brilliant to be here. And just, a couple of words of introduction. Really excited about this seminar. As Lucy says, the Empower projects are funded via the UK government's Global Research and Technology Development Unit and implemented by the Research Commissioning Centre. And this project is actually a continuation of two earlier Empower projects, also funded through the UK government, where we've delivered primary research and developed a new online called the She Can tool, which is an online support tool to help tackle gender-based violence on public transport in sub-Saharan Africa. And this project here is furthering that work and includes activities to help strengthen policy recommendations and training materials to engage new stakeholders in Kenya, Nigeria, and Zambia. And I see that there are some colleagues from those countries on this call today. The three main project partners are the Flone initiative in Kenya, the Lagos Metropolitan Area Transport Authority, or LAMATA, in Nigeria, and also the Zambian Road Safety Trust. And we've been working for 6 months now on this project, and we're really looking forward to the outputs of today's discussions on this call. I just want to personally thank Lucy Kahonge and the whole Flone Initiative team for the brilliant work they've been doing over the years in these projects to engage stakeholders, to further the cause, and in this case, help to develop a policy brief to tackle sexual gender-based violence, particularly in Makueni County public transport and informal transport. I'm really grateful for all the other participants here today and looking forward to hearing the exchanges from you all. Many thanks. Back to you, Lucy.
Thank you so much, Paul. And I must appreciate our colleagues from Makueni County. I can see they're already here. Also appreciate our colleagues from Zambia and also our colleagues from Lagos, that's Nigeria. And we are so happy that this is finally happening. And we hope also the participants within this call will have something to take home to your different public transport organizations, agencies, and be able to actually take action on addressing issues of sexual harassment and gender-based violence within your respective entities. Thank you so much, Paul. I want to welcome our next speaker, who is Evan Sumba. Evan Sumba serves as the program officer here at Flone Initiative, and he is an urban planner with over 6 years of experience in both the public and private sectors. His expertise spans in city planning and design, integrated transport systems, research, and project planning and management, and strongly emphasizing inclusivity and diversity in transport systems. His work is driven by the commitment to enhancing quality of life through evidence-based urban and transport planning, research, and policy development. Evans, over to you. Thank you.
Thank you so much, Lucy, for the wonderful introduction. Hello, everyone, and thank you for joining this important discourse. It's a wonderful afternoon. My name is Ivan Sumba, as previously introduced, and I'll be presenting this next session, the policy brief. And of course, this work has been made possible in partnership with Makueni County Government. We want to acknowledge particularly the Technical Working Group on Inclusive Mobility. We thank you all for your contribution in terms of contextualizing the issues. And in the next phase of this presentation, I'll just go into just trying to give a little bit of background into what the issue is, particularly focusing on the status of public transport in Makueni County. So public transport in Makueni County as it is broadly categorized into three main modes. So we have the road, rail, and air, but then the most dominant mode is road transport at 98%. It's very important to note that the road transport, which is the dominant mode, over 120 kilometers of the A109, that is Mombasa Road, passes through Makueni County. So this important corridor connects not only Kenya, but also from the port of Mombasa to Lagos in what fits into what we call the Trans-African Highway connecting Mombasa to the port of Lagos. So you can see what role the county plays in facilitating a local trade, regional trade, and also movement of people from place to place. It's also important to share that the main means of transport in Makueni County is dominated by walking, of course, and then we have border borders, we have public service vehicles and personal cars, then aeroplanes and trains. The most important aspect of this is intermodality, where we find people having to either use border borders, matatus, walk and use matatus, or border borders and walking. This is to ensure that last mile connectivity, so they're able to reach from their destinations to, So that just paints the picture of what the status of public transport in Makueni in terms of the mode, in terms of the region, the corridor, and the means. And what is the issue here? What we are here to discuss today is, of course, sexual and gender-based violence, which then is all forms of violence that happen to women, girls, men, and boys because of that unequal power relations. So this issue, how it manifests in public transport, for example, in Makueni, is as a result of the dynamics that results from socializations. There are primary agents of socialization, such as the family, the church, schools, and so on. So these are what feed into how SGBV manifests in different areas. And for our case, for Makueni public transport system, who is affected, of course, we have younger women who face this harassment on a daily when using public transport system. We have public transport workers, we have commuters. All these people are affected by the SGBV within this space. So we find that sexual and gender-based violence is a very important impediment to the inclusion of women in this sector. And in the next chapters, we'll be able to uncover what is the percentage of women representation as workers within Makueni public transport system. So The prevalence of this issue is, of course, within the public service vehicles, within the bus parks, the informal and formal bus stops, along the pedestrian roads, and in parking lots. So the whole transit system feeds into, is a playground where this issue occurs. And it's important to just note the consequences of SGBV to the economy, to the population. So it results into emotional strain. There's the health system, a strain on the health system, psychological strain. And just to give an example, so Makueni, as it is, we have the Makueni Gender-Based Violence Recovery Center. And the statistics or the data from that center in terms of the direct cost per survivor is approximately 71,865 or 556 USD. So this is the consequences of SGBV for survivor. So the direct cost here could include medical cost, legal fees, the cost for care and all that. So for one survivor, it's approximated within Makueni that fee is about 71,865. So that is the issue here, where it manifests and the consequences of that. And what we want to do here today is just convince the county decision makers, the stakeholders within this space, to adopt and implement targeted interventions to prevent and respond to SGBV. So we will be able to demonstrate why there is a very urgent need to address this issue within the public transport system. So in this next phase, I'll just be able to present the methodology that we used to come up with our findings and our recommendations. And we are drawing our findings majorly from the baseline survey report that we conducted in 2024. The baseline survey report was on the status of vulnerable groups in Makueni County public transport system. And this survey, of course, adopted mixed methods approach, where we combined quantitative and qualitative data. Through the qualitative data, we are able to conduct key informant interviews with community engagement, county departments, and all other key players that feed into this sector. And we also had focus group discussions where we are able to have sessions with older persons, persons with disabilities. We also had forums where we have empathy mapping sessions with school-going children, particularly located along Mombasa Road. So through that, then we are able to capture the experiences, identify the scale of the issue. And of course, that is not the only point where we're drawing our findings from. So through this, we are also able to get the feedback from the technical working group members on inclusive mobility, just in terms of contextualizing the issues and just giving practical recommendations that fit into the realities of Makueni people. So that is the methodology that we adopted just to come up with our findings and our recommendations. And our findings in the next phase, we just broadly categorized our findings into 4 main findings, from which then we've been able to also come up with 4 key recommendations. And in this next phase, I just want us to go through some of the key findings of that we want the policy action to be acted upon. So the first finding, of course, is the rampant cases of SGBV within Makueni public transport system. It's very important to note that the national average, Makueni actually falls below the national average in terms of the SGBV prevalence in the country. But then they've also just show that commitment towards just reducing these cases to as minimum as possible. And through these, we are able to have interviews, we're able to have collect data on these. And first, we just wanted to look at commuters' experiences of the SGBV within Makueni. So in the first figure here, we have how many commuters. Here it documents the commuters' experiences or witnessing SGBV in Makueni public transport system. So we have a percentage of 30% of the commuters say that they have witnesses, incidences of SGBV, but then 70% of them say that they have not witnessed incidences of SGBV. As you see it, it might seem to be a low figure, but then one case of SGBV, of course, is too many within the public transport system, as demonstrated by the consequences of SGBV. So one of the reasons why we're saying this number might be low is because lack of awareness of what constitutes SGBV. So people have normalized behaviors such as the obscene jokes, the explicit comments, the graffiti, the sexual propositions, the verbal sexual harassment, groping, and so on. So these are some of the things that people have normalized that then they're not able to categorize them as SGBV. That's why a lot of people indicated that 70% of them said they have not witnessed or experienced incidences of SGBV. So what we're saying is in the next figure where we have the frequency of commuter harassment cases, you find that very rare is at 40.6%, and we have occasional at 31.1%. So what we're saying is when these incidences are described as rare or occasional, it doesn't really mean that it really means they're tolerated and not eliminated. So through that normalization process, you find that now people have had a habit of just tolerating the incidences and not eliminating. So that's why we have the numbers here at 40.6 and 31.6. Is just describing it as very rare and occasional. Into the next finding in the rampant cases of SGBV within Makueni. So we went beyond the commuters. So we looked at the SGBV within the public transport workplace, just in terms of what is the public transport operators' understanding of what harassment is, for example. So, and then the different forms of harassment that they are able to identify that manifest within the public transport space. So we have verbal harassment at 47.2%, the physical, the 17% of the public transport operators who do not understand what harassment constitutes or is, and then we have 11.3%. So we are having verbal harassment with the highest proportion, involving insult, inappropriate comments, and all other forms. So as it is within Makueni, there is 4% representation of women in public transport. So you can see this as a huge impediment into their participation, either as users of safe and accessible transport system or participants into the transport economy. And we just lifted a figure just to demonstrate the contribution of the economy to the Kenya's GDP. The transport economy contributes 8.3 to 11.4% to the GDP. Narrowing it down to border sector, we found that it contributes around 600 billion into the Kenyan economy. That translates to 4.4% of the GDP. The sector as it is, the 11.4%, the 8.3%, that's a huge contribution that should want inclusive participation of all people within the space. But with these cases of harassment in workplaces, then you find it as an impediment to women's participation in this sector. And so the low number of the representation, particularly within Makueni, the 4%. And the next finding was on location and time of harassment incidences. We find that commuter harassment location was majorly concentrated within the vehicle, so inside the vehicles at 59%, then we have at the bus park, and then at along the pedestrian walkway and at the parking lot. So with those distinct locations, you can see that we are able to now move this issue to a more general one, to very specific and trackable areas. So we also have harassment incidences by time, concentrated in the morning and in the evening, fairly distributed throughout the day as well. But then you can see here at 36.8% concentration in the evening. We just have an account of somebody who witnessed an SGBV incident when they were traveling, and it says, I witnessed sexual harassment in a vehicle while traveling to school. It happened in a matatu while we are using a Mutongoi matatu. The conductor of matatu sat on a woman's thighs without her consent. The lady started crying out and was forced to alight on her way before reaching the destination. So in a normal and ordinary travel, you can see how this manifests. So you can maybe come out of your house, going to a particular place. Then within the commute, you're able to get to experience these issues along the way. The next finding was on reporting of SGBV incidences, and we are saying the reporting is constrained by fear, stigma, and weak response systems. We have the perpetrator distribution. We have the non-perpetrators at 58.1% and non-perpetrators at 41.8%. The reporting channels for harassment as it is, we have 41.9% of them do not report these cases. Some of them report them to SACCOs, but they do verbal reporting, so they're never actioned. And then we have police at 6.5%. Then we have alternative dispute resolution measures. So it's important to note that the perpetrators of SGBV incidences within Makueni are known people. When you get to the bus park, you will find out some of them are even mentioned by name. And this actually is why there's fear, there's stigma. People fear reporting because they fear repercussions. And when these incidences are reported, they do verbal reporting, which of course they're never actioned. There's that lack of the formal reporting, either by SACCOs, and that of course results into those cases not being followed up. So again, there's the normalization of SGBV, which prevents action by the police. So if you submit these cases, if you report these cases to the police, you find that whether if you say you are groped in a matatu, then they've normalized this behavior, and then this prevents action by the police. We have the alternative dispute resolution, which parties involved here resort to what we call tutamalizana kiwanaume, which just says we'll sort it out as men. So this, of course, undermines justice and just continues to reinforce impunity with this space. What is the result of all this? The result is a system in which both direct and indirect costs of SGBV continue to be borne by the population. So the results of incidences not being able to be actioned, weak response, and fear results into just a population where we both continue to bear both direct and indirect cost. The last finding on this is on the existing frameworks which provide. So within Makueni transport system, we have to, of course, acknowledge the commitment of the county towards social inclusion and gender equality. So as it is, we have the Makueni gender policy, we have the Makueni SGBV policies. Yeah, so these frameworks provide basis for action, but the application is public transport is still limited. The gap that we identified is they are mostly aligned towards formal employment, towards county staff and their workplaces. So that inward focus excludes informal working environment. The significance of public transport cannot be undermined. So the public transport space is a social stage. At some point, you have to interface with people within the public transport system. So it's where everything occurs at some point, and just the existing frameworks not being able to adequately address these issues within this space is a significant gap. The good thing here is the draft Makueni public transport policy presents this opportunity to bridge this gap. Within this policy, we have themes on equity and inclusivity. From the findings and from this policy brief, then we are able to integrate some of the policy statements that will be able to address the issues within the public transport space. Just to, again, go into the policy recommendations. So we've structured the recommendations in a way that we've identified the issue and what is the issue, how will it be addressed, and who is responsible for addressing the issue. So in terms of prevalences of SGBV in Makueni public transport system, so what is the issue here? So we are addressing the prevalence and normalization of SGBV in the public transport system. Overall, need to institutionalize awareness creation just to prevent and prevention measures across the public transport system in Makueni. How will this be done? So first, we're proposing development of enforceable code of conduct for public transport operators. Lucy had initially presented code of conduct for Nakuru County. So these, of course, has borne some fruits, and we're just thinking of scaling this again to Makueni County. Second, we are proposing organizing county dialogues in partnership with the county government on SGBV prevention and response. So this, of course, solely lies on national government, county government in partnership with stakeholders who would want to, of course, join this course. We are again proposing regular sensitization on SGBV and social inclusion. We have the public transport circles, CSOs, and GMC. GMC is the government of Makueni County. And also to address the prevalence and normalization of SGBV, we are proposing the use of information, education, and communication materials in vehicles, bus park, and bus stops. This is something that's already ongoing, but then there's need to scale it to other towns, to other sub-counties, just to ensure that this issue is adequately addressed. And who is responsible for this? Of course, we have the private sectors who can join in the course, yes, those, the public transport, the circles, and in collaboration with the government of Makueni County. In addressing issue number 2, which was in terms of where these incidences occur. So what is the issue there? Responding to hotspots through targeted interventions. How will this be done? We are proposing using the available data to just map the SGBV incident hotspot. So through the baseline survey, we've been able to identify, narrow the issue to the specific areas. So then through that available data, are we able to, again, map these incident hotspots? The next one is how will we respond to the hotspot? It's through just guiding intervention in high-risk spaces, which again we've identified as the vehicles, bus parks, parking areas. In these areas, we can do targeted enforcement and visibility materials. The next how is to conduct public awareness campaigns during morning and evening periods. These are the periods where incidences are concentrated. So we are proposing regular public awareness campaigns within bus parks, just to ensure that people get to understand what SGBV is, the consequences of it, and all that. The third, what we're proposing is strengthening reporting, documentation, and accountability. How will this be done? So we have strengthened referral pathways, legal aid clinics, public awareness on reporting, available reporting channels. At the introduction of the policy recommendation, there was a picture there of referral pathways. So we are proposing this to be something that can be adopted by the government of Makueni County. We have the legal aid clinics in collaboration with the judiciary. These can be conducted periodically. Again, public awareness on the available reporting channels. The second one is development of standard incident book for the public transport circles. So we have the responsibility of this, of course, lies in for the government of Makueni County in terms of just developing a standard occurrence book. Then this will be adopted by the public transport circles across Makueni County. And then we are also proposing designating clear reporting contacts and taking timely actions on reported cases. So with moving away from verbal reporting, then the actions can again be actioned. So the responsibility here lies with the police, with the public transport circles, and government of Makueni County. It's important to build trust in the system. You found out that 6.5% of the victims reported the issue to the police. So you can see there is lack of trust in the system, including the police, the judiciary. So we are proposing building trust in the system by fast-tracking handling of the cases reported, and of course, treating survivors with dignity. This solely lies on the judiciary, the police, and the national government in collaboration with county government. And to the general public, we are proposing active bystander action. This is just by safely speaking and reporting incidences, SGBV victims and survivors. Second is, of course, reporting incidences through available channels and demanding accountability from all stakeholders. The final recommendation is to integrate public transport into the county gender as SGBV policy responses. I've talked about the draft public transport policy, which provide opportunity to address these issues. So the Makueni public transport policy is still in the process of being developed, but then we've identified these issues and have a thematic area on equity and inclusivity, which then will be able to handle some of these issues that are being brought up. The second how is to strengthen oversight of SACCOs and other public transport actors to ensure that gender and inclusion commitments are translated into practice. And this solely lies on to the government of Makueni County. So these are that we are able to draw from the four main findings. Demands all stakeholders within this space, starting from the national government, the county government, the judiciary, the police, and the general public. Again, the private sector plays a key role in just ensuring that SGBV issues within Makueni public transport system are eliminated. Again, I talked about their commitment to social inclusion and gender equality, which is recommendable. So this is a continuous process, of course, and we'd like to just ensure that the cases go to a minimum as possible. That is the final part of my presentation. As indicated earlier, this project has been supported by the Global Research and Technology Development that is funded by UK government under Empower project. Thank you so much for listening to the presentation. I'll be able to respond to some of your questions later on. Thank you.
Yeah, thank you. Thank you so much, Evans, for that rich presentation. We are so happy to get those insights at this time. And you again, if you have any questions for Evans, please feel free to just type them in the chat. He should be able to respond to them. Unfortunately, we are not able to take questions at this time, but towards the end of the webinar because of time. And for the materials that he's been talking about, for example, the Makueni baseline report, you should be able to get the link in the chat and the link to the Shikan tool that has actually shipped the entire project. And it was launched back in 2022. You should be able to find the link also in the chat. So we are narrowing down to the panel discussion, but before I introduce the panel, I would advise that if you have any questions for the panelists and of course, Evans and our first speaker, Paul Curtis, please share them in the chat and also let us know to whom you are directing your question to. And we'll have about 7 or 10 minutes towards the end of the webinar to just respond to your questions. So I want us to get into the panel discussion, and I want to introduce our first speaker, who is Engineer Kamami, who is a Chief Mechanical Engineer with over 15 years of experience in sustainable infrastructure, specializing in energy planning and transport systems in Kenya. He holds a BSc in Mechanical Engineering and an MSc in Project Management, and currently pursuing his Master's in Development Finance. He is certified in public-private partnerships and ESG. He leads the development of the Makueni County energy plan and policy, and currently leads the public transport policy processes towards advancing safe, efficient, and sustainable mobility solution. Our next speaker will be Jane Macau, who is a seasoned social development professional, currently serving as the County Director for Gender and Social Services in the County Government of Makueni. With over 12 years of experience, she is a social scientist holding a master's degree in social development and sustainable livelihoods from the University of Reading, UK, and a bachelor's degree in social work from the University of Nairobi. She is committed to advancing social justice and protecting the rights of vulnerable populations with a strong track record in amplifying marginalized voices through policy influence and legal framework. And lastly, we have final speaker, who is Faith Mwende, who is the Assistant Director for Social Development in the Department of Gender, Children, Youth, Sports, and Social Services at the government of Makueni County. She is a gender and development specialist with expertise in gender mainstreaming, social safeguards, and social protections programming, and strong focus on SGBV prevention, response, among vulnerable groups. She's also an alumni of Swedish ICLD Gender Mainstreaming Program, and she advances social justice, inclusive development, and participatory governance. She holds an MA in Gender Development Studies and a BA in Community Development and Social Work from Daystar University. So again, thank you and welcome. And I want to start with you, Engineer Kamami. And maybe you could let us know what has the county currently done to promote inclusivity in the transport sector, and especially with a focus on addressing specific gender issues affecting vulnerable commuters and workers. Over to you, Engineer.
Yes, thank you, everyone, for joining this webinar. We are humbled, and thank you also that is to Flone for what you've been able to work with us. We value that partnership. You've asked me on what has the county done to promote inclusivity in the transport sector, especially on the specific gender issues. We have been able to do about 3 or 4 things, and I'll enumerate 4 of them. One, we have done research, the one that has just been presented there. It is on baseline data on the baseline survey on vulnerable groups that was done in 2024. That has been the basis of all that we've been able to do, or what we are doing after. That also informs some of the things that we're doing with in the Makueni public transport policy. We've also gone ahead and engaged the public transporters on that, and also on the schools. So we have the research and data to understand the mobility of the vulnerable commuters and also the workers. That is our first act that we've been able to do on it. Then we've been made efforts towards making the draft public transport policy, and also lobbying to finalize on it. That has been part of our governor's manifesto. We started this last year, that is the development of the public transport policy. There exists a transport policy, but it is inward looking. That is made only for the government. But remember, the government of Makueni works for the wananchi or the citizen. So in this case, that is why we have to develop the policy. And we've gotten to a point, but we are lacking we have gotten to develop the policy until the point of public participation that we're supposed to go, but also due, as you know, we've had cuts, and that has affected us seriously. And because of that, we are low on facilitation. Possibly, if we could be able to get partners to work with us on it. So that is all on the public transport policy. And then there is the sensitization of the public transport operators. Recently, last week, actually, we were able to meet public transport operators. We met 15 of them, actually, the managers of the matatus that operate in Makueni County. In Makueni, there are a number of circles in the matatu side. Actually, they are more than 30, but the ones that are domiciled here within the county are 22. So we were able to get 7 of them for a pilot, still working with Flone, and we gave them the headrests and that for the managers, and we are also to train another 60 of them in the coming month. So that is what we've been able to do. We have also reached out to schools, still going by what we saw in that survey. We have worked with NTSA, whereby we have visited the schools and done sensitization to the schools and also offered those bands, the ones that are worn on the hands, and also the bands that are the ones that are worn on the school bags. So that is what we've been able to do so far. We've worked with the National Police Service, especially on the issues of that abuse. You understand that there are things that when there is public indecency, it means that the police come in. So we have worked very well with the different police service members here in Wote, that is the Makueni, and also in Sultan Hamud. We have worked well with Kibwezi, Emali, and also Kikima. Those are among the 6 sub-counties in Makueni. So that is what we've been able to work on. Thank you.
Yeah, thank you. Thank you so much, Engineer Kawami. And I appreciate the fact that it's clear from where you sit that issues of abuse, sexual gender-based violence require a multi-sectoral or multi-stakeholder approach to ensure that they are addressed. And of course, I'm actually excited that you're also including the police within your interventions, and of course, issues of research and data, which is quite impressive. So I have seen there is a question in the chat. Please, if you have more questions, please just continue including them in the chat. I want to switch gears and pose my next question to Director Jane. And I want you to maybe update us on what interventions has been made by the government of Makueni County to address sexual gender-based violence in the county. And maybe you can also let us know the referral, the reporting channels, and of course, the shelters or the aftercare support that you have within the county. Over to you, Director Jane.
Thank you, Lucy, for the invitation, and thank you, members, for joining in to participate. As you have heard, my name is Jane Macau, the Director for Gender and Social Services. And I'm going to be taking you through some of the interventions that the County of Makueni has been able to put in place to address SGBV in Makueni. And I'll divide the presentation into various sections, whereby I'll be looking at the legal frameworks that have been put in place to address SGBV in Makueni, the infrastructure development that has been also put into place, then the capacity development. Then I'll also be addressing issues to do with the community awareness, that is the awareness and sensitization. Then I will also be looking at what else has been done, especially in the development of high-C materials, the legal aid, and all that. So as looking at the legal frameworks, as our past presenter has alluded to, the county has several policies in place which are geared towards addressing SGBV in Makueni. And as the presenter said, there's a lot of issues concerning the public transport touching on SGBV. They have not been elaborate in the policies, and therefore that it will be a gap that needs to be addressed. And to start off, we have the SGBV policy, which is for 2021, which is due for review, and also a draft bill, which seeks to address the issues of prevention, management, and response to SGBV in the county. The policy also provides the referrals and the participants in the areas of SGBV on how to address it. Then we have the gender policy, which seeks to address the issues to do with the, promoting gender mainstreaming in the government development and also in policies. You realize that where there's inequalities, there's usually abuse, and this is what the gender policy seeks to address. And then now we have the social protection policy, which is a policy that seeks to identify the vulnerable population in the county. And you realize SGBV and the police and the poverty, they are actually closely related. You realize those people from the poor households, they are actually prone to SGBV because some people take advantage of people's vulnerability, especially children, and those are marginalized populations because they know they have no voice, they cannot report, they don't even know where to report. And therefore, this policy seeks to cushion the vulnerable population. And then now we have the Atropua graduation policy. This is a policy that is actually very new in the county, and also it is an act that also seeks to identify the poor of the poorest, to support them so that they can actually graduate from from poverty and be able to stand on their own. And as I said, SGBV is actually rampant among the poor. And therefore, once someone has been supported and graduated from poverty, they'll be able to gain a voice. They'll be able to know where to report in case SGBV happens to them. And then we also have the children policy, and this one seeks to protect children against all forms of abuse. And you realize in the county, looking at the statistics, their children are really prone to SGBV. And these are they suffer this GBV in sometimes in the family setup, in the family, in the schools, even sometimes in the churches, and it's so unfortunate. And therefore, there's a time we conducted a safe space whereby we allowed children to speak, and they were able to bring out some of these issues that they face in their space. And therefore, this policy seeks to protect children against all forms of abuse, whereby SGBV is one of such. And then we have also the disability policy, and this one is meant to cushion, also protect the persons with disability to be able to address the issues that affect persons with disability. And you realize persons with disability, and especially children with disability, they have also suffered a lot when it comes to SGBV, and therefore the policy has been put in place so that it can be able to address this and to bring several players in the space so that it can also we can work together to address this issue. Then on the issue of infrastructure, the county has a GVRC center, and this is like a one-stop center whereby we handle the issues of SGBV, the issues to do with psychosocial support, treatment, the referral. From this center, they are referred where they can get support. And then now there's also the aspect of data collection. This is where we are able to get the data for SGBV happening in Makueni. Then on capacity development, we have done several trainings with the duty bearers, and here duty bearers are like the health staff, the police, the gender staff, and also other government staff, to build their capacity to be able to address GBV in their spaces. Then we also have we developed a duty bearers handbook, and this provides some information for those handling SGBV as duty bearers. And then now we have also trained anti-GBV champions in our communities so that they can be like linkages. They can be like the voice. They can be like the first point whereby in case someone faces SGBV, they can be able to identify. Then we did media training where the media was trained on ethical reporting so that now when they are reporting SGBV, they don't just report. There's a way they need to report, and they were taken through that. And some of these activities are supposed to be continuous, and therefore will also be it's a continuous process. It's not just a one-stop training. Then on community awareness, we have done several awareness campaigns in schools. We have done in the marketplaces. We have done also in the community, within the community, because within the community, that is where abuse takes place. And so we go to the communities and we talk to the community members so that they understand their role. It's their responsibility to protect their people. Then in the schools, we allow children to provide some safe space for children so that they can hear out some of their issues. And some of these activities are actually integrated in the other activities. Then as part of
unfortunately, Director, I have to cut you short because of time. Yes.
Let me say this one last.
If we have time, we will. Okay.
Let me say this last one. The gender sector working group, which we are encouraging the transport department to be part of it. The sector working group brings together stakeholders in the space of SGBV. Then we have also developed IC materials, which we are pasted and given border riders to pass the message. Then we also provide the legal aid so that the survivors of GBV can access their legal rights. And thank you so much, and sorry for taking time. Thank you.
It's okay. That was very, very insightful. If you have any questions for director, please again feel free to post them in the chat. I see there are so many questions that have been posted. I don't know whether we'll have enough time to respond to that. But before we get into the Q&A, I want to welcome Faith. And Faith, maybe you can shrink your presentation to 1 minute so that we can save the remaining 5 minutes for Q&A. Faith, and maybe my question is, what are the challenges experienced in policy implementation? You've had director talk about the many policies that the county has, but I don't know how best we are at translating this policy into action, and especially looking at issues of sexual gender-based violence, specifically in the public transport sector, where from where I sit, I feel most of the policies have been shy to address SGBV within the transport sector. And many of them majorly focus on domestic issues, employment issues. So maybe, Faith, you can take the mic and respond to that. Faith, you're on mute.
Thank you. Thank you. Oh my God.
Maybe as Faith is trying to fix her microphone and of course to resolve the echo, Engineer Kamami, I want to welcome you back for the last question. On now that we have the draft policy brief, what is the key take home for the county? Like, what are the next steps now that we have a clear policy brief with us? Engineer, yes, Faith is trying to fix her mic.
I hope you're able to hear me.
Yes.
Good. So you've asked what are the next steps on the county and what are we exactly planning to do. One is finalizing on the policy. We've already taken the data, we've already developed up to a certain extent, but we need to go to public participation. And so as to go for public participation, we will need that we have, as I said, we have a challenge with the financing on it. So possibly if we could get further partners, because already we have worked with Flone and we have worked up to that part where we have developed actually, and as you've seen, this policy is also part of it. So there is that part of finalizing on the policy. Then there is sensitization of public transport operators so that they are able also to engage and know what is happening on the public transport, how they can come in, and actually the issues that are SGBV. As you've seen, some of the people are not able to understand if that is actually abuse. They just think that that is a passing remark or just gesture, but in every sense that is an abuse. Then we engage a multi-sectoral approach with the different departments. As I've said, we have worked with the Department of Gender in the county. We have also worked with the Department of Gender, that is the Ministry of Gender in the national government. We have worked with the partners such as Flone, NTSA, National Police Service. We've also gone to schools and done all that. There is the peer-to-peer learning at different counties so that we know what Nairobi County is doing, what Nakuru, Mombasa, such counties are doing, what Kilifi is doing, and other counties, even Turkana, because we always have something to learn from each of them. And then we now engage the national government how they can be able to support us in all that. And in all these, we will be working hand in hand with the public transport operators. In this case, is the matatus, border borders, taxis, and et al. So that is what we are doing, and as the next steps. Thank you.
Thank you. And maybe are there plans to integrate recommendations from this policy brief into the public transport policy? If you could speak to that.
Oh, yes. As I have previously and as I've mentioned, the baseline survey has been our basis of at least we have known what is happening and what the issues were. And so also the policy brief has brought together the different areas, so we'll be able to incorporate all the learnings into the public transport policy.
Thank you. Thank you so much, engineer. And I can see it's already 1. So I'm requesting that you allow us to extend this webinar for 5 minutes so that we can respond maybe to 2 or 3 questions, and then from there we'll be good to go. And maybe Faith, if you've already fixed your microphone, there is a question from Victoria Ndola who is asking, and maybe also Evans, if you can respond to this as well. What is the participation of women in this process? Do you plan to have a toll-free number with both genders on can use? It is assumed the male gender do not experience gender-based violence. Do you have any findings on this? Thank you. Maybe Evans, you can take up the part for the participation of women in the development of the policy brief and the baseline survey, and then Faith, you can talk about the possibility of a toll-free number. Evans, over to you.
Yeah, thank you. Thank you so much, Lucy. So to just address the participation of women in the development of the policy brief, first is taking us back into the methodology, of course. So we find that as we conducted the surveys in terms of the transport surveys, we interviewed women commuters. We also interviewed male operators, majorly male operators, which provided feedback in what now informed the final findings that we're presenting here today. In terms of male experiencing SGBV incidences, yes, male are also, they do also experience SGBV incidences within the public transport system. Within the baseline survey, there are findings around what are the common forms of SGBV, common forms of harassment that they face, and you find that most of them documented verbal harassment and economic harassment. So comprehensive findings to these can be found in the baseline survey report on the status of vulnerable group, both available in Makueni County Government and in our Flone website.
Thank you. Thank you so much, Evans. Faith, are you back?
Yes, I'm back.
Unfortunately, we still have an echo. We will proceed, and maybe this question I will direct it to Engineer Kamami or Director Jane. What is the county doing to address sexual gender-based violence in the rural areas? And maybe Director Jane, you can take up that.
Thank you. And as I said, in the rural areas, we have been doing community sensitization forums, and we have the anti-GBV champions in the community. And these are the people who are able to report in case there are cases. We have been doing the same in rural schools, although we have not reached every corner because this is a continuous process. We have also been able to do male engagement so that men can be brought on board as players in this in the area, and therefore those are some of the things that we have been able to do, and we have supported even the SGBV survivors. I've seen a question of SGBV survivors on what you have done for them. We identify them as among the vulnerable population in the county, and they are included in our empowerment programs. We support them to access justice through our county attorney's office. They have been actually following up some of the cases. We also link them where they can get support, even some to save shelters elsewhere, because our shelter was temporary, and because of security issues, we could not be able to run it. And that's one gap that we have as a county. And also providing information to them where to report and what they should do in case something happens. Then we also rescue them. We have rescued several and even taken them to safe places. And we also have the toll-free number, which is actually run in the GVRC center. There's a psychologist who shall have the number whereby they can call. It's not toll-free really, but they can do a return. They can beep and then someone can call them back. So those are some of the things that we have been able to do. And we also have our sub-county officers in all the 6 sub-counties, and even the national government officers, whereby they integrate SGBV messaging during all the public forums, so that no one person is actually left without information. And therefore, we are just going, this is an ongoing process. We are not yet there. Yeah, thank you.
Thank you so much, Director. I had requested for 5 minutes for us to finalize. I can see we are already at 1:05 Nairobi time. I want to thank everybody. If you have additional questions or you still want to get in touch with us or the panelists or even the supporting partners, we are requesting that you channel your questions to communications@floneinitiative.org. We should be able to get back to you. From here, from Flone Initiative, we want to thank you once again from our partners in Zambia, Lagos, Makueni, and everybody else. We want to say a big thank you and just remind you to, again, subscribe to our newsletter and also follow us on social media because there will be more conversation regarding the same topic being discussed in the coming days. Again, thank you so much.